good afternoon, good afternoon, everyone. And how are we all doing this afternoon? We are at session number
Good afternoon,
6.
Cheryl.
How are you?
I'm
It's
doing
nice to
good.
get an answer.
Yes,
All
I'm doing
right.
fine.
So we are closing out our 6th session in our series. Thank you all for joining us. If it's your first time, welcome. If it's your 6th of 6, then awesome. Thank you for staying with us. So we apologize. Let's start by apologizing for being just a little bit late. Technical glitches. We worked out some, but we are going to proceed. So, for those who don't know just yet, my name is Cheryl Garrix Lloyd. I am the president of the Omega Kappa chapter of Sigma, and this is our infection prevention and control and non nursing webinar series number 3. We are closing out today with our second non nursing session, and we're going to be talking about professionalism. So, before I tell you about our speaker and what's going to happen, we usually start our session off with a little bit of a brain teaser. All right. So, let me say a very warm welcome to all of you here over in Zoom land, and a warm welcome to everybody who's joining us over in YouTube land on our YouTube channel. Thank you so much. So if you are ready, if it's your first day, we usually do a quick brain teaser to make sure we're all here and um, our brains are kicking. So we use the phone notepad or the laptop notepad, or we do good old fashioned paper and pencil or pen. So I've given you 30 seconds if you need to get the pencil and the paper so that you are able to look at it. And then the instructions are when it goes up on the screen, you need to use the time. I'm going to set the timer, and then you put, if you have the answer, in the chat. So for the last one today, I tried to find a very simple one. And what you're going to do is, if you have the answer, put the answer in the chat here over in Zoomland and or over on YouTube. So you don't, normally I'd say to you, give me the number of the answers and then send me a picture. This time today, we're going to say, put your answer in the chat. All right. Everybody ready? I gave you a chance. Are you ready? Nobody answering. You're not ready?
Yes, I am ready or I am banned this evening. Which one?
Of course, that screen. You're very all right.
Yes,
So wonderful. All right. So let us go. Let me set the timer. You're getting 30 seconds today because it's so easy. All right. So let me make sure we fix up the 30 seconds so that it will remind me. All right. And everybody's ready. We'll change the slide and I'll say go. So remember the instruction for today. If you find the answer, just go right ahead and type it in the chat when I say time is up. And then as we go along, we will see who we need to talk to about the prize. Everybody ready? Let us go. Timer going. Go. Five, four, three, two, one. Time is up. Put your answers in the chat if you got it correct. So while we're looking out for the answers, I want to say again, a very warm welcome to you. We thank you so much for supporting our series. It is our hope that the benefit is not just from getting your hours, but also from all the wonderful information we've had shared over these 2 weeks. So just a little bit of housekeeping. We are reminding you and encouraging you that you should join the session with your full name as you registered if you are joining us here on Zoom. For all those who are joining us over on YouTube land, please remember to type your name in the chat over there so that we are sure you are with us over on YouTube. For the persons who are joining us, you can't use just one name or it's your full name. You're going to be put in the waiting room. We remind you to keep your microphones muted, and we remind you that we'll get to the Q&A section. You can type in the chat your questions, or you can go right ahead and raise your hands and you'll get acknowledged. So as we close out today's session, we have a lovely, lovely presenter with us. If you've been following along as well, because they are over on YouTube for viewing even after the session is done, or moderators have been members of the chapter, and we have had presenters who also been members of the chapter. So let me tell you one guess when I say to you now, and over to you, Madam Moderator, who is a member of our chapter, an award-winning member at that. But if you didn't guess, because you don't see anybody else in here, I'm moderating today. So over to me from me. Today, our presenter is our chapter member, Mrs. Sandra Chisholm Ford, and we are closing out our series to talk about professionalism. We're not talking about nursing, but professionalism in general. So I encourage us as we listen up and take our notes, there may or may not be a question at the end. And I'd say we need to work it out that we are able to answer. So make sure you're taking your notes. So let me just tell you a little bit about our presenter before I hand over to her. Mrs. Sandra Chisholm Ford is a registered nurse, registered midwife, and she's a public health nurse who currently lectures at the UWI School of Nursing, Mona. She got her Master of Science in Nursing Education, and she's an active member of our chapter and other professional organizations, including the Caribbean Network of Nursing and Midwifery Educators and the Nurses Association of Jamaica. She has been a nurse for over 20 years, has always been involved in community development. If you look in the dictionary for volunteer, you probably will see her picture. She is also involved in several activities in high schools, and in particular, she's a member of the UWISON's Friends of Mona in outreach at the Mona High School. She's a board member of the Seaview Gardens New Testament Church of God Basic School, and she has mentored at both the primary and high school level. She has been working for the past 20 years, having her wellness activities, and she has been providing maternal and child health services for over 400 citizens at the Whitfield Town community. She has a clinic on a Friday afternoon. Apart from her many talents, she's also an author and co-author of several publications. And I now hand over without further ado to you, Mrs. Chisholm Ford.
Good afternoon, everyone. Thank you very much, Mrs. Garrett Lloyd. I was calling her my name because people tend to mix us up. Thank you again for that. I just noted in the chat someone commented that today should have been emotional intelligence. Initially on our schedule, that was the scheduled presentation for today. However, that was done yesterday because the presenter for today could not have done it today, so we swapped places. So
yes,
I do hope.
And let me just say, Mrs. Chisholm Ford, my apologies. We have been announcing it since we knew the swap had happened, but perhaps some persons were not aware that we had to change the topics.
So do accept our apologies, and I do hope that you enjoy this session, and feel free to view this session of yesterday on our YouTube channel. Since many of you may have seen me already, can I get permission to take my camera off because I'm having some bandwidth challenges? Do I have your permission?
Yes,
You may go ahead,
Sandra. Go ahead.
Okay, thank you. Thank you. Okay, here we go. I am hoping that we are all nurses and professionals on this platform, nurses, midwives, other professionals. So we are going to be looking at professionalism in nursing. And I found this image of some of our beautiful colleagues who are well decked out in their pearly whites and their caps. So what is nursing though? This COVID pandemic has re-emphasized to us the point that nursing in this 21st century is the glue that has held and continues to hold patients' healthcare together. As we journey in healthcare, we want to ensure that the persons that we work with are providing the accurate diagnoses and the accurate management of conditions as required. Hence, the role of nurses. We are indispensable, as many times as many of us know that we have to be watching our other professional colleagues and ensuring that they prescribe the right management for our patients, and we ensure that our allied health professionals are doing the right thing. What are some of the areas of professional concern that has arisen? I found 6. The first one is the professional use of social media. The other, professional image. The third, professional dress. The fourth, professional language. The fifth, professional deportment. And finally, professional lifestyle. How do we dress as nurses? And I really wanted an interactive session. I'm just checking periodically on my internet to ensure that we're all together. Are we together? Just give me a thumbs up in the chat if we're together.
Yes, we are.
Okay, awesome. So since the days of Florence Nightingale, nurses have been wearing uniforms. And many of us have looked through, those of us who have had the opportunity, we have looked through many booklets or magazines that have images of nurses, and we look at what was worn then and we compare them to what we wear now. And some of the pictures I'm seeing, I'm like, some of these nurses who were wearing those things, if in today's day and today's culture, they themselves would be punishing themselves if they saw themselves dressed like that. The uniforms are way above the knee. Some of them were mid-thigh. However, I must say they were always neatly clad, well, properly dressed in their white, and they had their caps. Why do we need to wear uniforms though? It differentiates us from other hospital staff. And it is sometimes embarrassing when members of the public look at other members of the healthcare team who may wear some clothing that nurses are wearing and they call them nurses. Many a times, I don't know if any of you do, but I have to be defending my profession to say, I'm sorry, that is not a nurse. So we have noticed that our uniforms have transitioned though. Many nurses are now resorting to wearing scrubs, and we'll talk about that a little. And I'm asking that you all chime in. This is not a lecture, so I want you to raise your hand and interact with me while we talk about this topic of professionalism. So our uniforms currently are culturally inspired and culturally coming from the days of cap wearing and apron wearing, and we have also realized that the styles that are recommended are really coming from our British ancestry and British heritage. My screen has frozen. Okay. Our professional dress causes us to be connected or disconnected from our patients. And speaking to some nurses believe that what nurses wear does not affect the ability of the nurse to make an emotional connection to their patients. It has been found, however, that it prevents the patient from making an emotional connection with a nurse. While the nurse may be comfortable in what she is wearing, whatever it is that she's wearing, whether it's her whites, whether it is loosely fit or tightly fit or appropriately fit, if the nurse is not properly attired in the patient's eyes, there may be an issue as it relates to patient care and the connection that nurses need to make to provide holistic care for their patient. Many patients believe that nurses who are not properly attired are not as bright and they're not as professional. And that image that is portrayed may be erroneous, but we need to be mindful of the image that patients that our dress portrays and ensure that we educate and inform our clients about our professional dress. Why do we dress the way we do? We dress that way because we need to be functional. Nursing is a physically demanding job, whether it's being on the ward setting, being in the community setting, or being in the classroom. You have to stand, to sit, to bend, to stretch, to reach, to stoop, to squat in order to provide care, whether it's care for a patient or I myself, I'm an educator, whether it is I'm providing educational care in the form of teaching, tutoring, or clinical precepting. In order to ensure that the uniform is functional, it must allow for ease of movement. And I have seen, and many of you may also have seen or are party to, very tight uniforms, whether they are tight dresses, whether they are tight skirt suits or pantsuits, they do not allow for ease of movement. The uniform should allow you to move freely, and the fabric should not chafe. So especially when it rubs on when it is too close and it rubs on your underarms or between your legs, it can also cause chafing and sores if it is not fitting properly. And it may also cause you to be sweating more profusely. Heavy sweating, of course, we know as nurses, may produce body odor, which eventually may become offensive to persons who may have to interact with us. And this also affects our grooming. Whatever we're wearing, whether we're wearing a uniform, as many of our groups wear, or we're wearing regular clothing, as most educators wear, it is important to be properly groomed as a nurse. Properly grooming speaks to what? Properly grooming speaks to your hair being combed. And I know that in recent times, culture has shifted to, I call it the new neat, untidy. Untidy is now the new neat for a lot of persons. If we notice in society now, where young men are wearing their pants mid-butt, and they may tuck a shirt all the way down to mid-butt in an effort to be neat. There's this new hairstyle that a lot of nurses embrace as well. It's a natural hairstyle where they use a sponge. It's called sponging, and the hair is rolled, giving it an just showered look. And that, though it is groomed, does not appear to be groomed. An additional importance of the uniform is the aspect of infection prevention and control. And the CDC had identified that long fingernails, artificial nails, gels, wraps, nail polish, all of that harbor bacteria, and it increases the risk of infection for both the nurse and the patient. And I mean, many nurses are annoyed that they are not allowed to wear, the profession does not allow them to do their nails or to wear nail polish. But it's not about us not looking nice. It is about the risk of infection that it poses. The microscopic chips and cracks in the nails, and as well as the changes that these nail procedures cause, encourage bacterial growth under the nails, and it increases the risk of transmission of bacteria to patients, and as well as nurses taking microorganisms from the hospital home to their families. Rings and bracelets as well. Rings and bracelets may actually be covered with a glove. However, the fact that our bracelet or a glove is present on the hand, it increases the risk of the glove being torn. So it is recommended that the use of rings and bracelets be limited so that it may prevent injury to the patient, because many of the rings that we wear, especially, persons are allowed according to the guidelines to wear a wedding ring or an engagement ring or a promise ring. And that most times has a stone attached, and these areas where the stones are fitted are areas that can cause injury to not only to the patient, but to yourself as well. The wearing of necklace. The wearing of necklace has also been seen as a no-no, because it may be grabbed by a confused patient, and a patient may be confused for any reason. Not only patients who are mentally ill, patients who are in so much pain and their pain threshold is low may become confused at any time they're experiencing that painful moment, and they may grab this necklace, which may cause it to break, or it may be grabbed by an infant or a small child unwittingly, and it may break and fall into a patient's wound, causing an increase in infection. So we have to be mindful of that as well. But all of this should be communicated in writing to all employees. And I want to ask colleagues, how many of you, by a show of hands, raise your hands in the chat, or those of you who are on YouTube, just letting me know whether or not you have ever seen the guide, the dress code guide from your various regional health authorities.
The policy manual.
And it is there. I'm just asking the nurses how many persons have actually seen it. Not being communicated to them, being able to look at it themselves to say, yes, this is what is written in black and white. Show of hands. I'm seeing one hand, two. Mrs. Garrix Lloyd, can you tell me how many persons on YouTube, if there's anybody over there sharing with us, if there anybody has indicated that they have seen this?
Not yet. It does go a little delayed, so I will let you know in the chat if anybody responds.
And I am seeing four hands on Zoom. And of the four hands, we have 41 persons here, and that means that'll be roughly 10%. I'm reading, Mrs. Young Stewart says it's communicated during orientation. I do believe that the staff should be able to eyeball this document so that they will know that this is not the dress code according to Maureen Young Sewell. It is written, and you are just
also, Sandra, when we have new staff, HR normally gives them a dress code, a copy of it.
awesome.
Yeah.
And for those of you who don't know, Mrs. Young Sewell is coming, or is coming from the East, St. Thomas. I know though that nursing schools, we have our different dress codes. And I know that for the School of Nursing Mona, ours is embedded in our handbook, and each student gets a copy of the handbook. If they do not get a physical copy, it is available on our website, and they are directed where they are able to find it. Because as professionals, we know that we have to have, for us to be a profession and to maintain our professional status, we have to have guidelines that our members follow. So we encourage at this point students who are graduating, so our student members who will be joining the ranks of nurses soon. When you get to become a professional nurse, it is important that you find out from your area of employment what their dress code policy is.
Mrs. Chisholm Ford.
Yes.
I want to put you on the spot.
Go ahead.
From one gender person to the next. Do you think we'll reach to the point, or we have reached to the point, or getting there, where we have to look at the white uniform that represent purity and womanhood and all of that? Do you think we probably need to change because of the sex stereotype that, the uniform represents a female, womanly? Because more and more of our population, our younger population, seem to embrace certain alternative lifestyle and probably would want to come into nursing, but then probably the white skirt and the white dress could be a deterrent. I just want to
a very important point, Cynthia, and I'm happy you say from one gender person to another. And I want to use this medium to thank my colleague, Dr. Pitta. Dr. Pitta just has been awarded her PhD in gender studies. And I am very happy that she is a member of the Omega Kappa chapter of Sigma, and she is a lecturer at the U.S. School of Nursing, Mona. Let me answer the question, Cynthia. I do believe that the white may be a challenge for
And
not
they
just
can describe. And they can
not just
describe.
not just a sense, not just, oh well, research has shown that when I was reading for this presentation, I found that many schools chose blue. Blue was the preferred color for the student nurses uniform. And if we look around, really, most schools used a blue or a shade, some different shades of blue. So I'm seeing where the School of Nursing, Mona, is the only school so far that really uses any color other than blue. But as we're speaking to the white and the types of uniform, at this point, the white is the color of choice for the graduate nurse. However, there is a standardized uniform pattern. For those of you who didn't know, there is a standardized uniform pattern that we have never been using. So I'm happy that we persons were free to choose the style that made them comfortable, whether it's a pantsuit, a dress, a skirt suit, whatever, and whatever style. We will, I do believe, with persons like yourself and I who are nurses who are embracing gender-related concepts that stereotype nurses and nursing, and the white may have to be looked at sooner than later, as it poses a challenge for purity and cleanliness. Because of the color, it is easily tarnished, and not many of us are able to keep it white. So yes, I do believe that we'll get there. And persons who are embracing their non-binary selves, who are non-binary, who ascribe to neither genders, have been engaging the profession of nursing and have been wearing the colors. But I think maybe the U.S. School of Nursing, Mona, may need to contemplate a change in the color of the uniform that they are allowing. So, did I answer your question, Mrs. Peter, Dr. Peter?
I just wanted to raise the issue. Sometimes, all right, if you think about other professions like the police and the soldiers, they have made amendments to accommodate more women. But in nursing, we just take it for granted that, people are coming and there's no discussion as to what we do. For example, probably I shouldn't say that, like UA Hospital that stopped wearing the cap. What does the cap represent? And would a non-binary person want a cap on their head? Working in other institutions. So that's where I'm coming from, this stereotype, this angel of mercy image that we have created that could have probably prevented more persons who want to do nursing from coming in. So I just wanted to put it on the table.
Yes, yeah. And persons yeah. Will. I'm imploring my colleagues to give it some thought, and
yeah,
we will. If when we no longer look like angels of mercy, persons may not be thinking of us as angels of mercy anymore. Maybe right. Maybe the look that we have, that angelic white look, may be one of the things that are holding us in the eyes of the public, because some of our behaviors are not so angelic.
Yeah.
Thank you, Dr. Peter. That was very thought-provoking.
Yeah, sorry.
Thank you. All right. So, of course, as we speak to the white, I'm seeing that we may come in contact with blood and urine or other body fluids. And for those of us who wear the white and those of us who are in bedside nursing may need to pay more attention to the look. And some persons I've noticed have tried to avoid this by wearing aprons and other things over their clothing. But when doing my study, doing my research to present this afternoon, I found that persons really preferred a nurse that wore a plain scrub. You know, when we thought of that, the pretty colored scrubs would grab people's attention. Research showed that when they asked the general public, many of them preferred us in plain colors. So when we are buying our uniforms or choosing our uniforms to maintain a professional look, we must choose clothing that can be easily washed and ensure that we use the proper disinfecting agents to remove all the infectious organisms from our clothing so that we do not pose them as an infectious risk to our patients, and we do not take anything from the healthcare facility home to our families. Additionally, when we look at the uniform, we can't speak to the uniform without speaking to the feet. And many nurses need to remember that we spend long hours on our feet, whether you are in the hospital setting, the health centers, or in the classroom. We must ensure that we wear comfortable shoes that provide us with good support. I know that comfortable, good supporting shoes are hard to come by. However, we must be mindful of that when we are making our purchases. So some research have been done. I spoke to this earlier when I was speaking to Dr. Pitta. It spoke to the color of the nursing uniform, and it showed that the color of the nursing uniform influenced the patient's perception of nurses. And a survey conducted in 2014 revealed that 57% of the patients thought that the solid color scrubs were more professional looking than the prints. And 95% considered navy the best color for nursing uniforms. And this was the study I was speaking of. But we have our professional responsibilities. And of course, what are our professional responsibilities when I'm speaking of that, I'm speaking of the ethical and moral obligations that we have as a profession. Profession means not me by myself or Dr. Pitta or Mrs. Gary Lloyd or Mrs. Young Sewell by ourselves as individuals, but all of us together as a group. And these standards relate to not only patient care, but it speaks to collaboration with other medical professionals. It speaks to our integrity, both our professional and personal integrity, our morals, as well as responsibility that we have when we are effecting social change. And whether or not we believe it, as nurses, we have a lot of impact on things that are going on in society, and society looks at us
Not hearing anything.
Ladies and gentlemen, let me just double check. I think we have lost Mrs. Chizanfo. Just give me a second. Let me double check with her. All right, everyone, sorry about that. I think her internet just threw her out. So we're hoping she'll be back in a short while with us. But in the interim, based on what she's been saying so far, was listening to the conversation. So I wanted to ask, is there anybody who has a take on consideration for the, you may raise your hand to be acknowledged, and or you may just type in the chat the conversations about considering the non-white as our uniforms. But I also know in general, in the institutions, for instance, departments like the emergency room and operating theater and some places have different colors. So what is your take on us considering not having white as the identifying color for our um, uniforms? Anybody? Ladies, nobody? Are you hearing me? Okay. All right. So the question is on the board. Anybody has a take on if we need to reconsider not wearing white as our identifying uniform, general nursing uniform? All right, it's all quiet. Is there any part of what Mrs. Chisholm Ford has said so far that we would like to give a comment or a question on? All right, so I think Alicia is saying, Alicia, when you say you're all for that, is it in terms of the uniform being changed from the white? Is that what you're saying? All right, so I'm just checking the chat. All for that, especially Joel says for those at the bedside. All right, yes, so you think we can make some changes and accommodations to perhaps have other colors. All right, so while we're waiting, Mrs. Chisholm Ford is coming back. I have another, maybe I'd say a spanner to throw in. One of the things I've seen or noticed is that when we have a setting where everybody pretty much wears similar things, what are some of the obviously identifying marks that we need to have, because everybody gets grouped together, and how do you know who is the nurse, who is the doctor, who is the other supporting staff? Go ahead, Angeli.
Good afternoon, everyone. My take on uniform as a nurse is I'm from the old school. I'm a UWI trained, and it's my opinion that the professional look of the nurse is important. Um, from my days, I remember the days when I was at UWI, from Miss Esteen, Miss Burton, all of those persons. They used to tell us that dressing professionally in your uniform. I remember we couldn't wear just your wedding band, the necklace. It came back afresh just now. Your earring could not be more than a knob, and you had to wear your skirt. If you're wearing a tight skirt, you could be called up, and it makes me, I feel comfortable. Wearing my white because I'm differentiated from the rest. Even now, over 20 years in nursing, and I still don't wear like nails if it's not like on an occasional purpose. I still wear my skirts moderately, and it even instill in me that, as Mrs. what's her name, Miss Sandra just now spoke about your pants or your clothes rubbing on your crotch and then it caused some irritation. I still wear my pants not closely fitted. So it all, I know that people are saying it's because of lifestyle changes and all of that, but I think that the white differentiates you. Even if you might change a bit, it still stands out that who is the nurse. And even if you walk out there and you have on your uniform without your cap and you're dressed in white, even if you're not a nurse, sometimes they will even say nurse because persons associate white with the nurse. It is just that we need to take some tips from this session to keep it professional in our dressing, as being the nurse, not having parts of us exposed, knowing the job that we do and the bending and the lifting and the stuff to do, but just directly. Thank you.
All right. Thank you so much, Andrea Lee. Mrs. Chisholm Ford, I believe you're back with us. So it was just two things I threw out to the group. They can still go ahead and type in the chat if they want to continue commenting. I was saying, is there anything else? The last thing I asked, what consideration would they have for identifying markers for us as nurses in a setting? And I just got that same comment over on YouTube where everybody wears the same multicolor, so on scrubs, the nurses are not per se identifiable. All the healthcare members seem to just be one. So that's what we were talking about before you came back in. I'm handing back over to you.
Thank you, Mrs. Garrix Lloyd, and I'm happy that you jumped in as a true nurse and filled in the gap when I was having some technical challenges. Thanks again. And I welcome this kind of discourse because I when you spoke about everybody wearing white and everybody wearing the same kind of clothes and we're not able to differentiate who is who. I remember watching cartoon. I love cartoon. I was watching Timmy Turner, and I remember one time everybody in that place, whatever ville it was, were gray. And everybody looked the same. But of course, there was one thing that differentiated everybody from everybody else, the teeth. Timmy Turner had two big front teeth that everybody looked at and knew Timmy from everybody else. So as nurses, there may be ways that we can stand out. I don't know how we're going to approach the white uniform. And Dr. Peter spoke about the Angels of Mercy. And we, despite the negative backlash that we get, I do believe that the general view, I think we need to do of the public, is that we are still angels of mercy. And as my colleague rightly said, what makes many of us be recognized at times and being because of the uniform. All right, so I was speaking about the excuse me.
Sandra, can I say something? I think I'm going to get cut off.
Okay.
All right.
I'm loading the wrong. Sorry, I just loaded the wrong presentation. Let me load the correct one. Sorry. Go ahead, Dr. Peter.
We know that I'm medical. You can hear me?
Yes, Dr. Peter. Go ahead. Dr.
I think
Peter?
I think our internet is going in and out as well.
Okay. So I think I just shared the wrong
Sandra, you can hear me
PowerPoint.
now?
Yes, I'm hearing you now. Go ahead.
Yeah, I think I'm getting cut off. I was saying that professionalism is not about what you will wear alone, but also our attitude. So it's very important that we look at attitude when we talk about professionalism. Because the minute a medical doctor walks on the ward, we know that there goes a medical doctor. So it's not about the uniform alone, but about professionalism. Because we can be wearing the right uniform, sewed properly, right length, and all of that. But our attitude is poor wearing the uniform. All right.
Awesome thoughts, Dr. Peter.
Yeah.
And what I believe too, that many of us or many people associate the medical doctor with somebody in a white lab coat though, and a stethoscope around their neck. Anybody that throws one of those jackets on and throws a stethoscope around their neck, they're going to garner that same amount of respect that medical doctors get, because persons ascribe that look to medical doctors. So let me pick up from where I was. And we're now looking at another thing that we need to be mindful of is our patient's interest. As a professional, we should always display compassion. And Dr. Peters just, I don't know if she was peeping over here on my next slide, but she just alluded to it, that we should always be compassionate and respectful to our patients, and we must be mindful of their self-determination. And she did speak earlier as a member, as a person with a PhD in gender studies, and myself, I'm doing my MPhil PhD in gender studies as well, and we have to be mindful that not everybody ascribes to the male and female gender that we are accustomed to. Persons are associating with many different genders, and we need to be respectful of that. We need to be compassionate of that. We need to be compassionate of persons of different ages, nationalities, races, or medical conditions. And it is difficult at times for many of us, because we are human beings, but we need to be mindful that as nurses, we are trained, and our training as such should prepare us for the many different categories of persons we will have to interface with. And we must be mindful that compassion and respect is what we do as professionals. But we must also be mindful of conflicts of interest and ensuring that these conflicts of interest that we may encounter does not pose a safety issue to our patients and impact on our professional integrity. So if there is an issue that you may find that may impact your professional integrity, it is imperative that you speak with your supervisor. And let me give you an example. If you are a nurse and you may be in an entanglement, and you find that the other party in the entanglement may pop up on the unit, and you have to care for that person. As the nurse, if you find that may be a challenge for you, it is within your right as a professional to ask your supervisor to assign you to a different area. And that is for my colleagues who are working in the hospital setting. For my colleagues who may be in education, same thing. If a person comes, if you are teaching and one of your children or a very, very close relative sits in your classroom, it is imperative as a professional to make sure that there is disclosure. Everybody who is concerned needs to know that I have a child in the class, or a niece or a cousin, so that persons may know that I will not be giving this person a higher grade than another person because we are related. So we need to be mindful of these things as professionals. We also need to be mindful of our advocacy role. We need to be mindful that it is your responsibility to be qualified and competent to perform a task that you are doing. If you cannot perform a task, if you were not trained to perform a task, do not attempt that task. As a professional, if you are not an ICU trained nurse and an emergency pops up, do not grab an endotracheal tube and say you're going to do an intubation. That is outside of your scope. And as a professional, you need to be mindful of that. And another important point is ensuring that your nursing license is up to date. And in other jurisdictions, persons have been penalized and been made to pay fines if they practice when their license have been expired. But nurses in Jamaica have been enjoying providing nursing care with expired licenses. Not until something happens while your license has expired and you get in trouble before you realize that what you are doing has legal implications. And we need to be mindful of the ethical and legal implications of things that we do. This is one of the reasons why the Omega Kappa chapter of Sigma has been offering these sessions, so that you can at least have opportunities to be able to have the required hours to renew your license if you so desire. We must be vigilant as well. If we have colleagues who are impaired, and an impairment, first thing that jumps to our mind is mental illness. Mental illness is not the only impairment that can befall persons. Persons who are visually impaired. Some of us, our eyesight diminishes with age, and I can tell you, my friends I tell them all the time, if I don't have my glasses, I'll look up in a wall. Just exaggerating, it's not that bad, but we need to be, you know that if you don't have your glasses, you're unable to pull up the correct dosage of a medication. We need to look out for patients, colleagues who are in those situations. Oh, excuse me. And remind them of their professional responsibility as well to not cause any harm to our patients. We have a duty to be respectful and moral to ourselves. And I put her here, and I'm sorry, as a person with gender, I did not edit this, but be mindful that we are not being gender specific here. We're talking about the nurse as a person, not as a gender. We need to express moral wisdom, courage, and honesty. And I will talk about Nurse Vote, that the nurse that was sentenced just recently for the medication error in the United States. And I want to applaud Nurse Vote for being courageous and honest, because she could have, I don't know if she could have, but many persons would have tried to not be honest about the error that was made. But Nurse Vote stepped up and she took responsibility for her action, and hence the entire nursing world stands behind her now that she's waiting to be sentenced. We must also be mindful that us as nurses who are in leadership, we need to give our subordinates an opportunity to express their grievances in a positive way. So if we have a subordinate who is angry about something that we have done or has happened on the unit, we need not to make them feel bad about expressing themselves. And I'm happy that Miss Nurse T was unable to present today, and she presented yesterday, because this presentation really followed well behind her presentation on emotional intelligence. Because in order to be good nurses and good leaders, we need to be mindful of emotional intelligence and how to ensure that this fosters ethical nursing practice. We have a duty, a professional duty, to share knowledge. So, and I'm happy that that was one of the things that COVID has caused on us. We have been sharing a lot of information among ourselves, because many of us were in groups together. And when we find things that are edifying, and we share information about different webinars or seminars or new trends that we identify in our readings and so on, and it is this sharing that we do is a part of our professional responsibility to share and spread knowledge about health and wellness and the avoidance of disease. And many of us, if you're not doing that now, and the members of Omega Kappa chapter of Sigma and the Nurses Association of Jamaica, we have all been active in community outreach programs and civic activities. And many of you believe that as nurses, we are to divorce ourselves and not think of politics as an important part of our nursing practice and our nursing profession. Politics plays an important role, and I think Mrs. Garrix Lloyd, if I'm not correct, you please correct me, or anybody else who, for that matter. I think Dame Nita Barrow I think she was our first nurse in the Senate, or is it Mary J. Sivrite? But if it's not Dame, it's Sivrite, and then our own very own Syringa Marshall Burnett. And those nurses went into politics so that they can impact nursing. And it is not because they wanted to be an active PNP or an active GLP. They knew that in order to effect the changes that were required to grow nursing as a profession, they had to get to that point where the Senate was the seat that they had to be in order to effect that professional change that we so desire. Ethical standards, open and constant discourse with colleagues about ethical issues. So every now and then when we have these in-service education sessions and our continuing educational sessions, we need to include areas and examples and case studies about ethical issues and ethical dilemmas that will help many of us to navigate some of these challenges when they arise. We also must affirm the values of the profession to other members and ensure that we adhere to enrollment in our professional associations. And many, I hope none of you on this platform are guilty of this, but there are some of us who believe that we should not be members of our professional organization, which is the Nurses Association of Jamaica, because we say, well, NAJ I do for it. And that is the talk of a lot of persons. And the NAJ is the sum of its members. It is all of us combined that makes the NAJ. And professionally, if we are members of our professional association, we are able to, just like those 6 young ladies who came together and decided that though they were few in number, they would start something that grew to over 560 chapters in the world, with thousands of nurses being a part of the Six Sigma Theatre Tour International. So these traits are important professional traits that nurses must embody. Nurses must be timely. And of course, timeliness means getting to work early. Getting to work at 7 o'clock for a 7 o'clock shift is not timely, because the handover process should happen before the shift starts, so that the new shift should start on time. And that is an important professional trait. Good communication, and good communication includes both verbal, written, and body language. All three in tandem speaks to good communication. Good communication, the use of the English language. This is our primary language spoken here in Jamaica. We need to be able to speak it and write it, as well as be able and knowledgeable in the use of nursing and medical language and jargon, and these should be used as is necessary. And when I hear, when I'm on the units and I hear people talking about, when they're speaking about a patient, they talk about bed 5 and bed 7 and bed 10. Ladies and gentlemen, we do not nurse beds. If we're not sure of the patient's name, we should say the patient on bed 5 or the patient on 10, and not a bed number. We should be attentive to our colleagues and attentive to ourselves and attentive to our clients. Attentiveness, seeing yourself for who you are, seeing how you dress, introspecting, assessing your own professional standards, modifying and improving as you see necessary. Attentive to the needs of your colleagues, making sure that you attend work when you should. If you're unable to, you call in advance, giving your colleague enough time, or giving your employers enough time to find a replacement. Being attentive to the needs of your patients, being attentive to changes in the patient's health, so that you can make necessary recommendations for change in management, as well as being attentive to the changes that were ordered, so that you can be up to date with the management of the patient. And if the many I've had students who have not been so attentive, and an order was changed, and they attempt to serve an order that has expired, and they did not update the record. So these attentiveness traits are what are necessary as a professional. Friendly. Friendly doesn't mean that you walk and hug and smile with everybody. It's being cordial and courteous and being good morning and popping a smile and asking, how are you? And when you ask, how are you, actually want to know how that person is. And one day I was in an elevator and somebody was passing and she said, good morning, how are you? And I said, good morning, I'm not so good. And I said, thank you for asking. And I stopped her, and I decided I was just being funny that morning. I started to tell her how I've been having a headache for how many days. And when I have the headache, and she was standing there with her eyes wide open, and she's like, really? Why are you telling me this? And I laughed. She didn't say it, but her eyes said it. And I laughed and I said, I'm saying this because we do this all the time. We pass by people and we say, how are you? And we don't really care to know. We say, how are you? Just because it is something to say. If you don't want to know how I am, don't ask. Just say good morning and move along. But if you're going to ask me how I am, be prepared to know how I am and help me to fix how I am if I'm not having a good morning. And she laughed and she said, I never thought of it that way. And it is something I do sometimes when I am in a funny mood and I want to give a little trouble. Passion for the job. Everybody, when they're starting nursing school and they do that interview, we ask them, oh, why did you choose nursing? Because I'm passionate. And I'm happy that 99.9% of us came into the profession with that passion. And I hope that we all maintain that, because that is an important professional trait that we are required to have. The ability to multitask is another trait. Nurses, we are octopi or octopuses. No, Lord, that don't sound so right. Octopi, who may have to do several things at a time, especially now that our nurse-patient ratio has increased and we have to be taking on many other tasks that our colleagues have left us with. We spoke of integrity a little earlier, and along with integrity comes honesty and transparency. If you are not transparent and honest, you cannot speak of having high integrity. So these are the important traits that we must have. So when it comes to courtesy and respect, most standards of behavior are basic. So we must use them all the time. So our nonverbal cues, our tone of voice, they communicate much more to our patients than our actual words. And when I read this, and as I said, when I was reading up to do this presentation, I have to be mindful, and I'm saying that we are human beings first. And I did say that the presentation on emotional intelligence speaks a lot to how we will be able to, if we apply what was said yesterday in the presentation, we will be able to look at how our nonverbal cues and tones communicate a stronger language than our actual words. So we have to remember that courtesy and respect are conveyed through much more than the words, because we can say something, but our tone is not saying the same thing as our words are saying. And I noted that the problem with professionalism is that it means different things to different people. And I want you to keep this in mind when we look at how we use social media. If I ask out in the audience how many of us use social media, I do believe that everybody will put their hand up. And so there are different social media platforms, and each social media platform comes with a different audience and different challenges. So you need to know why you are using social media. Are you using social media for entertainment? Are you using social media to find jobs? Are you using it to find a spouse? Are you using it to enhance your professional growth? Are you using it to help with your spiritual life, your personal life? It is up to you to introspect and determine why you use social media. And this information, let me use the disclaimer here. I got this off the website from the, let me tell you the name of the, it's eluding me, but I will tell you in a moment when it comes back. Cheryl, can you help me? The school that does online, a lot of online.
Is that Walden?
Walden, yes. Thank you. Thank you. Thank you, Mrs. Garrick's Lord. Yeah, we also need to know the difference between each social media platform. And I had to tell a friend the other day that she needs to take her 9-year-old daughter off Twitter. It's not Twitter, TikTok. Because TikTok, on your stream, you can be watching something that is nice and soft and appropriate. And then the next video that comes up is loaded with expletives and other material that is not age appropriate for children. We need to begin by following somebody. Choose who you're following when you follow someone on social media. That will help to open doors for you depending on where you want to go. Follow people. Mrs. Garrick's Lloyd testifies to this every day. She follows the Sigma Theta International webpage. So whenever she sees them post the webinars and so on, she gets them immediately and she puts them in the group so that we are able to access them, because many of us don't follow the page, or if we follow the page, we are not as following as we should be. So she just gets them for us and we are able to access these educational sessions. But after you become a follower, according to Walden, you need to establish your presence. Speak. Have a voice. Tell other people what you stand for. If you're in a chat group, or if you're in a WhatsApp group with somebody, you need to speak in the group. If people post things, comment on them so people know what your positionality is, so that if something comes up, they will know who to call about what and who to give what to. And in everything that you're doing, you need to remain professional in what you're doing. So it says you can build an effective online presence without understanding the benefits of doing so. So social media allows you to create a far-reaching network of peers and leaders in your chosen career area. It allows you to stay up to date on the latest ideas and trends in your field, and it announces your accomplishments and presents yourself as a thought leader in your profession. And I must tell you that I was just telling Cheryl at the beginning of the thing that I got an email from the Financial Times that they're interviewing me about the nursing shortage in the Caribbean, because I did a radio piece on Power 106, and I spoke to the nurse migration and the shortage, and someone from the Financial Times all the way in the United Kingdom heard the clip and decided that they are going to be interviewing me. And they were able to connect with me because I was on LinkedIn, and they were able to find me on Facebook. So, your presence and how you portray yourself out there tells people what you are able to speak on, so that they are able to approach you for that. And you must, of course, share your knowledge and provide information that may be used to enhance the profession of nursing. When you are communicating, and all of this is about communication, we must remember that eye contact is important. Create an environment of courtesy. People talking to you, come on, but in all good faith, come on, look at the person. Show that you are interested in what they're saying. It is very disrespectful to be doing something while someone is speaking to you, or if you're having other conversations while someone is speaking to you. If you are on the telephone and someone comes to stand in front of you, the professional thing to do is to tell the person on the line to give you 1 minute, that's to hold on for a second, and you address the person in front of you, to ask them to give you a moment to finish your phone call, and then you continue your telephone conversation. But it is very disrespectful and unprofessional to be on the phone and have someone stand there, because first thing is that they're listening to the conversation that you're having, and second of all, they're thinking, why is this person not acknowledging me? And I'm sure many of you may have had experiences like that and would have found it very, very offensive because you were not acknowledged. Depending on what you're doing, it is okay to talk while you're doing it. But when you're answering a question, ensure that you give the person your undivided attention. And if you have to do the task while you're talking, you need to just tell the person, just pardon me for a second while I'm doing this. And these things just tells persons that you are mindful of them and you are respectful of your communications with them. And please always address persons by name. When you deal with patients, your body language, as I said before, is very important. You must use what we call open body posture. You need to face the patient and don't cross your arms or turn away. And if you're say, for example, you're setting up an IV access or IV line, and you're hanging the IV on the stand, and the patient is speaking to you, as I said before, just tell them, just give me a minute and I will address your concern in a moment. Or tell them to just hold that thought, or if you have to stop what you're doing, if it is very important, you need to stop what you're doing and address the conversation that you're having. You need to practice active listening. So you need to be nodding, agreeing, and sometimes you need to repeat what they're saying so that they can clarify if you have said the incorrect things. And so these things that I'm saying, ladies and gentlemen, are just refreshers for us, and we need to be actively engaging in the conversations. So we have 10 things that we need to use for professional communication. And the first thing on the list is emotional intelligence. Then you have cohesion, clarity, friendliness, confidence, empathy, respect, listening, open-mindedness, tone of voice, and of course, answering questions. Conflict is something that we must encounter. Regardless of how much we try to avoid conflicts, they will arise and they must be handled in a professional manner. When you have experienced a conflict as a professional, you need to avoid responding in an unprofessional manner. It may be hard for some of us, but we need to try as best as we can. We need to ask that the person, if it happens in a public space, we ask that we ask the person to come, let us talk about this inside. Take the person to a room or to a secluded area and continue the conversation there. And I'm going to be sharing with you a little the findings of a study that I was a part of. One of my students did the study, and it is about the image of nursing. And it's just that why I decided to share this is because it was conducted among student nurses and nursing students. So it was a total of 116 respondents, and it was important to know that 25, it was done at the US School of Nursing, Mona, and it was done among undergraduate and graduate students. And it was noted that the main age group was 21 to 25 years old. These are relatively young people, and they made up 67.3% of the cohort. 8.5% were Jamaicans, and we also had 3.5% Bahamians, 1.8% African, and 7% from other islands. Most of them were married, 77%, and 77% were single, and 20.4% were married. We also found that they were 63.7% cited that the desire to help others was the main reason for starting nursing training. That was the main reason why they decided that they wanted to become nurses. However, 15.9% were advised by their family members that if it's not nursing they're going to be doing, they're not going to be paying for any tertiary training. While just a little bit of them, 11.5%, chose nursing as a career because they saw nursing as the profession that were able to take their families out of poverty, and it provided an income for them. It was a good source of income. 87.6% of the respondents had a relative or a friend who was a nurse, and that actually also impacted their choice of choosing nursing as a profession. They all believe that nurses were hardworking and caring and understanding, and 88.4% believe that nurses treated their work as a profession in its own right and not secondary to doctors. But my concern here was the 11.6% who thought that nursing was secondary to medicine. And I do believe that we need to reach that 11.6% and remind them that we are our own professionals. Only 44% thought that nursing had social status attached to it as a profession, and alarmingly, only 11.5% of the respondents out of 116 persons would encourage their children to become a nurse. Despite all of these good things that they thought about nursing, they still would not encourage their children to become a nurse. 75% believe that the nursing image affected staff recruitment and retention, and 24%, only 27.4% of nurses said that they got along well with each other. 69% of them thought that nursing training was challenging and not everyone could become a nurse. However, it was concluded that undergraduate and graduate nurses at the School of Nursing Mona had a positive perception of the image of nursing, even though they agreed that they did not earn a good salary or work in a comfortable working environment. And more than half of them said that they would not like their children to become nurses. 56.6% stated that they love their profession, as more than half of them agreed. And 75.9% revealed that nursing image affects staff recruitment and retention. Thus, a positive image would increase the number of prospects to the profession. So we need to improve the image of nursing, our professional image, so that we can attract more persons to the profession. And at this point, I would now take your questions. Over to you, Madam Chair.
All right. Thank you so much, Mrs. Chisholm Ford. When I heard you say that, take your questions. Hear me. All right. Maybe you are Just you're gonna keep this part going. All right. So thank you very much, ladies and gentlemen. You have heard um all that Mrs. Chisholmford has to say. As she reminded us at the beginning, it's an interactive session. It was not necessarily a lecture, and she would like us to talk. So if you're joining us over in YouTube land, I'm waiting to see your comments as well. And I've noticed one hand went up. I'm looking out for hands and comments over here in Zoomland. So you may go ahead, Pearl Shaguri Russell.
Okay, good afternoon, everyone. I would say very good presentation.
And I've noticed one hand went up.
Pardon?
We lost you just now. Was somebody else speaking?
Hello?
You may go right ahead. We're hearing you.
Okay, I was saying good afternoon. And I was saying it's a very good presentation, very basically reinforced a number of things that, yes, we have been taught at the beginning of our training. There's a concern I have, though, for something that was said. Not that I disagree, but just to say, I suppose because of the ratio that we have with patient staff ratio, when she stated that, like, for instance, you're setting up the IV and you're asked a particular question from the patient that you must stop. And so it can be a little tedious when you have a ward full of 40 patients with probably 3 nurses, and you're doing a particular task for one patient, and in your head you're saying you have 3, 4 more to complete before time expire. And so it can be challenging for you to stop. I'm not saying, that you're to disregard what the patient is saying, but to stop, drop everything and turn almost like, full attention to deal with that person's question. Because I know it can be said while you're talking to the person and doing what you're doing, it can come across very disrespectful. But for me, I think if you acknowledge a person and said, yes, Mr. So-and-so, what are you saying? Or Miss So-and-so, but you continue with, and while you talk and do both. But I find that it would be challenging to stop in the middle at that point to, just address the person at that particular point.
Okay, thank you very much, Nashaguri. And I didn't say stop and drop. It's remember I said in your professional discourse, you need to turn to the person when you are speaking to them. So if you are unable to turn around at the time, you communicate this to your patient. Say, Mr. Jones, let me just finish what I'm doing and then I will address you. You don't have to stop and drop. As professionals, we are able to assess our situations, and we should be able to determine what necessitates or what warrants or immediate stop and drop, or what can be addressed at a later time.
Thank you so much for the comment. From YouTube, Mrs. Ford, we have 2 comments, very valuable tips and wonderful presentation. I'm waiting on the questions, so let me just double check here again. Are there any other comments or questions regarding what is it that we had? I asked my question earlier, Mrs. Chisholmford, while you were having the technical difficulty to everybody, but I'm not sure. I was saying while you were presenting, I know Mrs. Dr. Peter had said it's about the attitude as well, but I was waiting until you got to that part because I know you said you had 6 areas, and I'm sure that would have been a part of it. We were just talking about the uniforms at that point. But from YouTube, Karen had the comment, which I was also thinking over here. So let me just throw it out to you. In consideration of, I'd say maybe the white that we are accustomed to. We may not change it, or we may change it. It's great to have the conversation. I was saying personally, I wanted to know what are the other things we could do to distinguish us, because I'm telling you, even in our healthcare system, when you wear pink clothes and gray clothes and white clothes, and the patient want to say who it was, them just said the nurse. And people have said the nurse in the white uniform or the one in the pink and white. So even if we're all wearing the same thing, then what is it that would make us the nurse, or is it not that important?
And that's a question, Mrs. Garrix Lloyd?
It is. I'm asking,
Okay,
is it that we need something that would identify us if we're not going to be wearing white as nurses in a hospital setting, for instance, or new nurses? Because we have persons who are joining us from other countries. I don't know if we all wear just the white, but I was saying, for instance, in the emergency room and in the operating theater, in ICU and so on, they have moved into wearing colors that identify them in that setting. So I'm saying, even if we discuss it and we change or we don't, the white has made us stand out as nurses. If we're not going to be wearing white, what else would we be able to do to identify us? Or is it not that important if we are identified?
And thank you very much, Mrs. Garrix Lloyd. It is always important as a profession to stand out and appear when you are performing your professional task, to be the professional that you are. And because of the fact that nursing is a female dominated profession, it has generally been accepted that everybody, most females who work in the healthcare setting are nurses. And we also have to be mindful that there are other persons who wear white. The practical nurses, a lot of them wear white, and persons in hairdressing school wear white. But what differentiates us from them are our badges, the type of material that we use to make our uniform, as well as sometimes it is just how we look. Sometimes when you look at how and maybe it's because I'm a nurse, my professional eye shows me who a person is, but the general public would not be able to differentiate. And that is the concern that we have, because the general public sees everybody as nurse. And I don't believe that, even though we are having this discourse here in this setting, I don't believe we are anywhere near, and we ever be anywhere near in our lifetime, to changing from our white to another color. Because what I'm seeing, I've read some states in the US are thinking of going back, because they had moved away from wearing the white, but they are going back to the white because of the same challenge. They call it the deprofessionalization of nursing. So they want to start by getting the nurses back in the white uniform and the cap, so that they get that professional. That's what they say. This is not my words. Don't kill me. I'm just telling you what I've read, so that they get back to that professional space that they were in several years ago.
All right, thank you.
Okay, Cheryl.
Go right ahead.
Okay, so we are contemplating about the white, but remember, not all nurses wear white. Public health nurses wear brown.
But that's what I was saying, Madam Maureen, for
Right,
the nurses in the
yes.
hospitals who are wearing that, because even in the hospitals, if you work in different areas, you are not. But as a new graduate, that's what makes us identifiable in our country and region, so to speak. It has always been that white uniform. Directors
Yes,
of nursing don't
definitely.
wear white anymore.
Right, and some persons don't identify them. They don't know the uniform.
That's correct. So I would say, in response to that, one of the things we've done as a chapter that we have fallen behind on, and we're hoping to be able to pick it back up. We started we approached the Gleaner here, we hope to do it across the Caribbean if we have our counterparts, to say persons sometimes don't know enough about us, except they say the person in the white is the nurse. And we also find that except for nurses in white and the public health nurses, the nurse in the brown, they don't even know your title. They don't really know about us, the public. And as Sandra was just saying, perhaps it's that they don't know that's what a part of our concern is. And I said to her as a chapter, let's approach the paper and let's put our own narrative out there, because we shouldn't really be waiting on somebody to say, no, it's not so. And the nurse, this person would be that, and this person is so on. And if you see this uniform, it's so on and so forth. And so we wrote, starting with the nursing students, and then we started looking at that we're more than just the white uniform. And there are others of us, because as Sandra said too, now that we are teaching and we go into the clinical space, we wear a lab coat to protect ourselves while we're out there. And even the patients, when you're passing them, say, doc. And I'm saying, I used to joke and say, it's a lab coat. Why is it owned by doctors? And or any male who wears a bush jacket, doc. And it's maybe a part of how we have identified and the public has been socialized. So I would say, I don't know if we're going to or we're not going to. And I know we all don't wear white, but is it that we need to consider ourselves then doing more work to educate the public about who we are, so that we're identifiable and it's not just a matter of the uniform? Because to be professional really is not only about the color and the style, but what makes us identifiable, and do we need to educate the public some more? So I'll take any thoughts and comments on that. Madam Presenter.
Thank you, Mrs. Garrix Lloyd. And I'm happy you mentioned that, because as a public health nurse, and I don't wear, up to this week, somebody stopped me to ask me, what kind of nurse am I? And I do believe that the pandemic had brought the public health nurse more into the public view because of our role in the management of the COVID-19 situation. But today we have spoken on a lot of issues other than uniform. We have spoken a lot on how we communicate, our social media presence, and I want us to be mindful of those as well, and not just the uniform discourse, and how we communicate, not just verbally, non-verbally, and how we wear our nails, how we wear jewelry. And as students, all the time, I have to tell students that it's not because my ear picky and my grudge for your long hair why I tell you to pin it up. You know, I had to stop a medical student the other day and to tell her that your germs isn't sterile. You are going to, that hair, she had braids all the way down to her butt. And I said, when you are going to be sitting, your hair will be on the ground and you're going to be taking that back home to your family. And, these are things that not just nurses, as healthcare professionals, we need to be mindful of the infection prevention role that we have as professionals. So the uniform speaks to that, how we wear it. And when I think of the uniform, again, as it relates to infection prevention and control, and I say the white uniform forces us to wash it. If we wear colors that do not show the dirt as much, some of us may not be so inclined because it wouldn't show that it's dirty. So I do believe that may be one of the arguments that may come up when the argument of changing the color of the uniform comes up, because research has shown that the caps has been a source of infection, because persons do not wash the caps as often as they should, and it causes and it spreads the MRSA and the other communicable hospital acquired infections that are spreading. So, this discourse really highlights some of these important points.
Agreed. Agreed, Madam Presenter. We are waiting if there are any other questions or comments. I'd agree with you because what we want is the consummate professional, and we are human beings, but we are required as a profession. When I just started nursing, there was a conversation that was being had about, are we a career or are we a profession?
I remember
And we
that
were
too.
able to pinpoint what is it that's required of a
And the
professional
professional
and that we
traits that we
have
need.
it. And
Yes.
that's why we are a profession and not just a
We
career.
had to fight for that nomenclature. We had to fight for being called professionals.
Wonderful. So I would say it's a reminder for us today based on all you've highlighted for us, because I'm sure some of it is a reminder. Some of it is work in progress because the social media is a very touchy one. All these nurses who are TikToking on duty. In our country, maybe across the Caribbean, it's not yet illegal, so to speak, but in other countries, it's grounds for instant dismissal. So as you've reminded us on several different areas today, the communication, really and truly, we'll never be perfect and it won't always be great, but more than anything else, we group together. And it's, for me, though I'm not wearing a uniform, I'm always a nurse. So when them say the nurse them, it's very upsetting to me. And that's how the public views us when something is bad. And so I'd want us to be more in the media for a lot of great things in nursing and as nurses, because we do other things besides do nursing. So as you've reminded us today, I'm loving it because having had to fight, and we're standing on the shoulders of those who fought for the nomenclature professionals, we can't afford to allow our actions or behaviors or deportment to give it away. It's a constant reminder. We can't afford to give it away. So I'd say all of us have to work individually and we also have to work collectively. We need to be able to pull our colleagues aside and say X or Y. Maybe we need more of these sessions to just keep reinforcing, because all nursing students learn about the profession of nursing in school. And so we have to ensure we're keeping that going. I really want to thank you for closing out our series. On this note, I'd agree with you that initially we had professionalism and emotional intelligence, and we apologize again to anybody who didn't get the notice we sent out to say we had to change them around. But I agree with some of what you said today, that yesterday was a good preface to today. And more than anything else, I think today was a great topic to close off the webinar series. So I'm waiting because I usually have a little bit to share about our organization. I got Camille in the chat. She's saying, Tanya says, wonderful presentation. Camille said, I loved this session, by far my favorite of the 6. She said, it packs a lot. Camille, it packs a lot of nostalgia too of my experiences as a student nurse. It has boosted my motivation, and she wants to give us thumbs up. So Camila, I'd say thank you very much, and to all the others who have highlighted these things. The last thing I'd like to point out in our conversation, which will be a different thing another day, is that we've come to recognize, based on the definitions at the ICN level, that for nurses who are already nurses and studying, they are student nurses. For nurses who are just going to be learning about the profession of nursing, to become nurses, they are nursing students. So we're going to have that debate at another presentation, Camille. If you want to go ahead and open your mic and say something, that's fine.
Okay, good evening. I was just saying that, Omega Kappa, your organization is a blessing. Believe me, I've never heard of you guys until I was trying to, renew my license and be own. So, it's great referral from a colleague of mine, So I've learned a lot of your organization, and it has definitely put things into perspective for me in terms of, where I want my career to be. So thank you very much to Mrs. Ford for your presentation.
All right, thank you so much, Camille.
Thank you, Camille.
All right, I'm giving us 30 more seconds before we close off, any other last comments or suggestions? Anything I may have missed in the chat if you want to raise your hand, or any other last question before we close off? Maureen Young-Sewell says, excellent presentation, which is a reminder of how we should conduct ourselves while interacting. All right, 30 more seconds. Anybody else just to close off? All right, so no. Go ahead, Patricia, I see your hand. Madam Patricia, you may go ahead. Your microphone is open, but we're not hearing you.
Yes, are you hearing me better now?
Yes, we are hearing you now. Wonderful.
Yes, I must say all of the presentations were very, very good. You can see that the presenters, they went ahead and did their studies and their researches on the presentations. For this group about the Omega Kappa, at first when I saw it in the group, I was saying, is this thing authentic? Because I'm trying to get online and I'm not getting online. So I was saying to my friend, listen to me, I pay my money, if nothing is coming forward, you have to pay me back. But you went ahead and you introduced it to us and let us know that, yes, it is real, because it's first I'm hearing about this book. Honestly, the very, very first I'm hearing about it. And I do hope that it will continue for us, not only to get ours, as you keep on reiterating, but for us to be reminded of our profession and what it entails, and also to learn new things. So for me, if I'm supposed to say, well, then today's presentation is good, then yes, I be lying. All of the presentations are good, because I'm sure all of us learned something, or we were reminded of something that, yes. So just keep it up, and I do hope to continue on this. I've asked to be a member, and I hope that.
Welcome, Patricia.
All right. So with that being said, thank you so much, Patricia. Thank you to everybody who has joined us. And just in case, as I'm saying, you're joining us for the first time, or maybe you never heard a little bit about who we are, I wanted to be able to just tell you a little bit about us as a chapter, and then we'll close off our today's session and our series. So this was our brain teaser for today. There was one every day, and I will double check and just let you know who won today, because I think it was maybe about the fastest fingers before we close out. But just to give you a little bit about who we are, this is a few minutes, and then I will just tell you, if you wish to join us, then this is what you need to do. This one went on Tuesday. We thank the persons who came out, but have a quick listen. Hello, everyone. My name is Cheryl, and I have the distinct honor and privilege of being the current president of the Omega Kappa chapter of Sigma. Geographically, we are located at the UE School of Nursing, Mona in Kingston, Jamaica, but we are a multinational chapter with members here in Jamaica, in Trinidad and Tobago, the Bahamas, the United States. Is my screen black? Because I thought I lost the picture just now. Are you seeing the picture?
No, it's not. It's black.
All right, let's try this again. Hello, everyone. My name is Cheryl, and I have the distinct honor and privilege of being the current president of the Omega Kappa chapter of Sigma. Geographically, we are located at the UE School of Nursing, Mona in Kingston, Jamaica, but we are a multinational chapter with members here in Jamaica, in Trinidad and Tobago, the Bahamas, the United States, and in England. Let's talk about our 2019-2021 biennium. It was filled with ups and downs, and though we were a little disappointed, we were also grateful for many things. We do miss our face-to-face interactions. We miss each other as well. And Despite that, we continue to give of our best, we continue to maintain the protocols, and we continue to support our members and colleagues, especially those on the front line. Let's have a quick look at our biennium to date. We had a few activities we had to cancel or postpone, some planned, some are annual activities, and we even had to cancel our first year anniversary celebrations. However, we did start our biennium as a 1-month-old chapter conducting our health fair or annual International Coastal Cleanup activity or mental health day activity, and we were able to attend our first Sigma Biennial Convention in Washington. And we had our membership participating individually in various outreach and educational activities. Let's have a quick look. And as COVID came to our shores in 2020, we are grateful we were able to complete the following activities. We had our first radio and television interview, our first Zoom chapter check-in, just to see how we were doing as membership. We were able to use e-cards and videos to celebrate all our major days in nursing and midwifery, our anniversary, and to close out the year for Christmas. Planned our first virtual webinar, commenced an article series about nurses in a local newspaper. We were a part of the Post Leadership Connection CEO live chat, had our first virtual induction to close out the year, and had our members participating in various activities and attending Sigma webinars. Let's have a look again.
It's International Year of the Nurse and Midwife, and with the COVID-19 pandemic, they've been under unusual pressure across the world, where nurses are more than just their uniforms. And joining us now to tell us about the work of the Caribbean Honor Society of Nursing is Cheryl Garrix-Lloyd, lecturer and president of the Omega Kappa chapter of Sigma at the
And in 2021, we've continued with sharing up the Sigma resources with our membership or other colleagues and the nursing students. We're participating in outreach and educational activities as individual members. As a chapter, we are also actively participating in our regional activities in COVID-19 education and vaccine campaigns. And we've been accepted for presentations at the biennial convention coming up in Indianapolis. We were able to submit 2 members for the International Awards for Nursing Excellence, and we've been collaborating with other chapters. Another quick look. And so as we close out the biennium, we continue to work on engaging our members to increase our social media presence, to continue to have publications and continue with our series, to have other educational webinars, to have a chapter and membership celebration event. We continue to infuse joy and continue with outreach and educational activities. All right, so I wanted to just share about what we've been doing in the last 2 years, because you will realize the Omega Kappa chapter of Sigma is just 2 years old. Well, actually, we're going to be 3 next month, and we're all excited. But really what we wanted to say, I think Mrs. Chisholm Ford alluded to it in her presentation. If you haven't heard the story, this is what happened. 100 years ago, we are celebrating 100 years this year, and our very first chapter is celebrating their 100th year as well. 6 nursing students wanted to have something to do as their co-curricular or extracurricular activity in the Indiana University School of Nursing in Indianapolis in the United States. And these students couldn't find anything that reflected nursing excellence. And so they said, you know what? Let's put our heads together and create something. And they went to their nursing tutor at that time and said, this is what we like to do. And she said, all right, let's help you and let's support you. And we could get it done. In so doing, these 6 students were able to conceptualize and create what is now called Sigma. The official name is the Sigma Theta Tau International Honor Society of Nursing. And they used to call themselves STTI. We are now just called Sigma. Sigma is in over 100 countries. We have over 550 active chapters, and there are over 135,000 nursing students and nursing leaders who make up this ginormous nursing excellence organization. So really, Jamaica has the chapter because you have to have a school of nursing or healthcare facility for your chapter to be housed. So our address is at Uison, Mona. But as you heard, we have membership across the Caribbean and also in the diaspora. And what it is we are saying is we're a place of nursing excellence. We welcome others to join us. And this is a part of what we're doing to keep our members, to benefit our members, and to get new members. Because I know persons didn't know and don't know, we are encouraging you. Look out for us, listen out for us. We've been doing things, we are continuing to do things, and we're not only trying to do it for our membership. Our hope, in keeping with the vision and mission of Sigma, is that we are developing nurse leaders everywhere to impact healthcare anywhere. And so this is a part of why we are here. So we are saying to you, we don't only want you to get the hours, we want you to hear the information, we want you to share it. We'd like you to join the chapter and help us to shine and shine bright. You know, they love to see Jamaican people. You saw that picture of the four of us and the flag. I'm telling you, we took that at the convention in 2019 in Washington. And can I tell you that when we went back to convention last year in November, that picture with the four of us became the face of everything at the convention. It was on the notebooks, it was on the screensavers, it was on the first slides of the PowerPoints. And I'm saying, look at the Omega Kappa chapter of Sigma. We are working on ensuring that wherever our members are, they're able to actively participate. And we are certainly saying, as we're housed in Jamaica, it is a part of what we want to ensure we're doing. So we've collaborated with NAJ, we've collaborated with CNO, and we're working on spreading our wings. So for the persons who didn't know and they weren't sure and you want to make sure we weren't trying to scam your money, we were not. But we understand that it's a concept that has happened. For the persons who were a little bit mad at us, there are still some out there who said from the last webinar, they didn't get the certificate, it didn't have the right amount of hours. We say to them, we're an honest society. It's important for honesty, integrity. And the words of the 6 students who created our organization, they chose Greek words. I'm sure in keeping with all the activities at that time being Greek. And they chose, if I'm not mistaken, Tharsos, Storage, and Time. Those are translated into love, courage, and honor. And that's because they said every single nurse should have those 3 qualities. So we encourage you if you're interested. We are going to be 3 on the 30th of May. We're having our anniversary celebration and induction on the 31st. If you are interested in joining us, you may have missed a session on Tuesday. It's all on our YouTube channel. For everybody who has liked and subscribed, we thank you. All of what we've done so far, well, let me rephrase that. Most of what we've been doing virtually like this is on the channel. It stays over there. We'll continue to put things over there. So anything you think you missed, feel free to go back and to see the information. So the session we had on Tuesday for nurses, it's still there, but we're encouraging you, write a letter of application. Say to us, we'd like to join your chapter, and this is why, and this is what I've done, because our organization, Sigma, is about nursing leadership, nursing scholarship, and nursing service. We're asking you to give us your current resume or CV, and we're asking you, can we get a character reference as well? Email them to us, attached, addressed to our counselor with the attachments, and quickly you'll be hearing from us because we want to ensure that we invite you to join us in our induction ceremony for the end of May. And before I close out, people always ask, is there a cost attached? There is a cost attached because in order for us to be able to give back, to volunteer, and to have that impact, it does come with a cost. So we normally pay our annual membership fee to our international organization. There's a section that goes to them and a part of it that comes back to the chapter. And so that's how we're able to do the health fair and to do the other things, including contributions from our membership, of course, because it does take that kind of caring. So it's, let me just tell you so I don't have it incorrectly. I believe I sent it out yesterday. For persons in Jamaica who are interested in joining, it is that you will need to pay 92 Jamaican dollars, US dollars, to become a part of Sigma, and then you will renew each year, and the renewal is $72. If you're in a high-income country based on the World Bank's classification, so I believe like Trinidad and the Bahamas and some of those other countries, the US, It would be $140 for your induction. Everybody pays at induction. The renewal is less. So to be renewed, if you're in a high income country, then we're looking at paying $120. Nursing students and retired nurses pay the same to be inducted, but for renewal, they actually pay a half of the cost. So renewal is $70 in a high income country. And for Jamaica, it's $46 if you're a nursing student or a retired nurse. A nursing student also means if you're doing your master's or additional training, it still applies. So we are saying to you, have a look at our website, have a look at Sigma's website. They offer great information that you're able to take away and to give you more. They have resources on there that you can access, even if you're not a member of Sigma or Omega Kappa as yet. And we want you to help us to help the nursing excellence light to shine bright. I can tell you my personal pet peeve is when they talk bad about us, and a lot of the times on the news, what they talk about is the negative. I really want us to be able to have so much positive to outshine any of those that when it comes up, you're like, really, that doesn't even sound like a nurse. So I know it's not an overnight thing, and I know a lot of good is happening and it's not getting highlighted either. But I'm encouraging you, consider it, have something to offer. Even if you're not a part of our chapter and you're not sure you want to be, contact us. We do have people volunteer with us who are not part of the chapter to do all kinds of different things. So just look out for us. Follow us on social media as well, because we try to keep what we're doing updated on there, so you'll be able to see what's coming up and our highlights of what we've done. We're on Facebook as the Omega Kappa chapter, and we are on Instagram as Omega_Kappa_Caribbean. Like our channel, it will notify you when we go live, and certainly you know how to reach out to us via email. You've all had to email us, and we're going to put it in the chat again. So if you're interested, we encourage you. Write your application letter, get your current resume, get your character reference, and send the email. And we really, really want to thank you for joining us, for participating in our series. We want to encourage you to look out. Within 4 weeks of today, we will have everybody's certificate sent out to them with their hours that they have attended. I know some people have asked, we did say in our emails, if you don't attend, then you're not able to have the COs because it's right now for live sessions. We are working on what we have available. At some other point that we'll be able to find a way to make it accessible and you'd still be able to access those hours. We're asking you to remember that if you can't get something, send the email and somebody will respond to you. We promise. And to close us off, I always try to do so. I want to, if I can remember, say thank you to our moderators for all of the sessions. All our moderators have been chapter members. Thank you so much to our presenters. Some have been chapter members, some are honorary members, some were new this time, but we appreciate because we worked hard as a fundraising committee to try and figure out what to offer you that was most beneficial. I want to thank my membership because even if they're not here, they've been sharing and putting it out there and anything else. And I want to thank the fundraising committee who put this together. So we have some prize winners too. I wanted to say congrats to them. They're going to be getting their prizes as we start out next week. We have Camille Bell Duncan, Maureen Young Sewell, Debbie McFarlane, Nadisha Brown, Andrea Saunders, and Shanette Sims. I think this evening our winner is, hold on, let me make sure I got it right. I think it may be Derica Jones. I'm going to double check for the beginning brain teaser. And if it's possible, I want to say thank you especially. I think if I missed anybody, please forgive me. But I have Keisha Bamberry, Camille Bell Duncan, Alicia Bennett, Lewina Boyd, Chantel Burton, Celia Green, Jodian Hall, Derica Jones, Vivette Lawrence, Debbie McFarlane, Chantal Meikle, Karen Miller Henry, Cynthia Pitter, Britea Seymour Daly, Joni Valentine, and Maureen Young Sewell as the persons who would have joined us for all 6 sessions. We want to say thank you so much, and we encourage you. Each one share with the other. Tell them about the YouTube channel. They can still get information. It has been a wonderful experience. So the last thing before we close our series, you know how it goes. Who is ready to answer? There's only one question. Just like at the beginning, type it in the chat. YouTube gets a little extra time to answer because they know they're hearing us a little bit behind. Thank you, Karen. She says the series was extremely on point for her. And Jennifer says, great series. So again, at the beginning, we said, what was it? The answer was correct. It was the letter N. Mrs. Chisholm Ford typed first, but unfortunately, she knows the rules. The presenters and the moderators are not eligible for the prize, or else I would give it to her. However, Sharida, my apologies, please. Jameson Morgan, Sharida is our winner for tonight for the
Unfair.
letter N.
I didn't know the question.
Mrs. Chisholm Ford, you knew what it was. So
I didn't know the question.
Sharida Jameson Morgan, Sharida, I'm going to put my number in the chat and ask you to please get in touch with me so that we can talk about your little prize. I know everybody's ready for the last question for the last prize of this series. All right. I don't hear any answers, but I assume that you're all ready. So the last prize we're going to be giving away, one single question. At the beginning, after Mrs. Chisholm Ford did such a wonderful introduction, she said, when she examined professionalism, although she did put it up there on a slide that it means different things to different people, she identified 6 areas. 6 areas that she would have talked to us about. What are those 6 areas? So I'm waiting to see the typing going on. Time is going. What are the 6 areas that Mrs. Chisholm Ford said she would have been talking to us about? All right, let me see what's going on over here. Nobody typing anything yet? Oh, typing must be happening. Mrs. Chisholm Ford, you have your slides. You can find it. So
yes,
at the
I
time you can
it.
share the screen. Wonderful.
Sure.
That's why I asked the presenters, don't leave it now because we have to make sure. Don't share it yet. They're going to get it.
Oh, I'm share it already.
Oh, wonderful. But nobody said anything, so take it back off. Perfect. All right. Somebody said goals and morals. Who anybody else typing? You have about 30 more seconds. Or the prize is going and gone.
Professionalism in front of all of those.
All right, Madam Maureen, professional, social media use, image, dress, language deportment, and lifestyle. We are waiting to see who else is typing before it goes on the screen. Lysiane is typing, but so far she has 3. Anybody else? How are we doing over there in YouTube land? Anybody has a 6? A few more seconds. All right, counting down. Come, Mrs. Chisholm Ford, let's go ahead and share it and let's see. Nobody can say that's what they were going to type, you know. All right. Mrs. Chisholm Ford, you can tell me if Mrs. Maureen Youngswell got the answer right?
I think she did.
Lisa Ann was quickly going into it as well. All right, are you looking in the chat for me so we can verify if these are the persons getting the prize?
Okay, Maureen was quick on the draw.
So she had all 6 of them?
I from what I'm seeing.
Social media, image, dress, language deportment.
And
Mrs. Youngsu will take notes, you know. That is what she
all
told
the
us
time.
when she won the first one.
She's a note
all right,
taker.
I saw Lisa Ann also typing. So then she said professional image. And then she came back and she said deportment, lifestyle.
I'm going to make sure I take my
social media. All right. So we thank her for participating.
I believe you.
Lisa, and what did you miss? Hold on. We see the dress, deportment, the social media, lifestyle. Did you say image? Yes. And there was one that you missed. 2, 3, 4, 5. I'm only seeing 5. Oh, you missed the language. All right. Never mind. So, Mrs. Maureen Youngswell, Thank you once again. All our winners out, they know what the prize is already. So Mrs. Young
You're
Soul, we're getting a little
welcome.
heavier. But more than anything else, we want to thank you for participating, for responding, and for joining us for our IPC and non-nursing webinar series number 3. On behalf of the Omega Kappa chapter of Sigma, it has been our privilege and honor to have had you, and we look forward to welcoming our new members at our induction and anniversary celebration in May. We want to wish you all the very best. We want to remind you that there's a pandemic going on. As you give care for others, above all else, remember to squeeze in a little care for yourself. We can't be great nurses if we're not taking care of ourselves. Have a wonderful evening. Look out for your certificates within the next 4 weeks. And if you have any queries, just send us a quick email. And the last reminder, interest to join, your application letter, your CV or resume, and your character reference. Have a wonderful, wonderful rest of your evening, everybody. See you again for our next session. Perhaps it's going to be in June or July. That's when we had our annual webinar. We had the very first one 2 years ago in the pandemic in July. So I think July will have something else on the table. And anything else in between, just look out for it. You'll see us. It's out there. Follow us on social media, like, subscribe, and share that the information is out there on our YouTube channel. So even if you didn't get to join live, then you will also see it out there. Have a wonderful evening, everybody. Bye-bye.
Bye, Miss.